as you mentioned in your opening remarks, there's only been 10 or 12 years of exposure to these agents, and it's increasing dramatically. And there have been some hints recently that there is an increase in brain cancers in people who have used these cellular communication devices for a number of years.
What are the considerations with respect to an additional potential risk for children using cell phones?
Children have a configuration of their skull that does allow penetration of cell phone radiation deeper.
Are you saying there's a potentially greater risk?
I'm saying there potentially is a greater risk. And
what limitations, if any, then, any parents are watching this on C-SPAN, what should they do?
I wish I had a good answer to that. I think
Well, would there be a precautionary approach? How about the use of earphones to minimize risk?
I think that's a good idea.
If they can do this, they would be better to have some kind of device like this.
As I understand it, yes.
We've modeled now a 6-year-old, an 11-year-old, and a 34-year-old. If you look at the 6-year-old, you'll see that the white area, right under the phone, and the yellow-red, the hottest area, goes all the way from the cheek, all the way up into the eye, and all the way down into the top of the spinal column. If you look at the 11-year-old, you see it also still gets into the spinal column, but the area is a little bit less. And by the time you get to the 34-year-old, it doesn't get into the spinal column and is not affecting the eye in as hot an area. All right. We are also doing modeling of iPads and modeling of Google Glass. And in all of these, we're finding that levels can be quite hot, much higher in the younger brain. Why is this? The head differences between the adult and the child, there's no difference in exposure to the head. And that's what industry says. They're correct. There is no difference in exposure to the head. But into the brain, which has more fluid and a softer skull, there's clearly a higher exposure. And even if the exposures were identical to the child and the adult, the child is not just a little adult. Their brains are less myelinated, they're growing more rapidly, and they need more protection. That's why we put helmets on them. That's why we put them in special car seats until they reach a certain weight. Children need more protection than adults, and our standards do not take that into account.